Good afternoon, and thank you for joining our briefing on the City of Philadelphia's response to COVID-19. Today, all of our speakers are joining the briefing virtually to adhere to social distancing guidelines. We will begin our briefing today with opening remarks from Mayor Jim Kenney. Mayor, you now have the floor.
Thanks, Kelly, and good afternoon to everyone. As we announced last week, the city and community partners are launching access centers to support Philadelphia's most vulnerable children during digital learning time this fall. Registration is required. Families can express their interest in registering by completing our online form at phila.gov/access centers. It's phila.gov/access centers. I must stress that access centers are not drop-in centers, nor are they replacements for our schools. Please also note that we are prioritizing students whose caregivers must work outside of the home and who cannot afford or access another child care situation. Once you have filled out the form, a member of our registration team will call you or email you with the next steps. Filling out this form does not guarantee your child has a spot. It does not guarantee a spot. It is the first step in registration. More information about access centers, including answers to questions you may have, can be found at phila.gov/access centers. Again, phila.gov/access centers. Cynthia Figueroa, Deputy Mayor for the Office of Children and Families, is joining us today to answer any questions you may have on access center enrollment. If you need internet access for digital learning, PHL Connected can help provide in-home internet access. The number to call to sign up for PHL Connected is 211. This hotline is open 24 hours a day, 7 days a week, and is available in over 150 languages. Philadelphia's K-12 families who do not have any in-home internet access or have internet access only through mobile phones should dial 211 and press option 1 to speak with a resource navigator. When families call the hotline, they will receive general information about PHL Connected, such as eligibility for the program and how eligible households can get connected. Also joining us today are Mark Wheeler, Chief Information Officer, and Otis Hackney, Chief Education Officer, who can also answer questions you may have about PHL Connected. And now it's time to turn it over to Dr. Farley for his updates.
Thank you very much, Mayor. Good afternoon. I have good news to report today. We're seeing a decrease in our COVID case counts and in the percent of people testing positive. Here are the numbers. Since this time yesterday, we've identified 85 new cases of the coronavirus infection in Philadelphia residents, bringing us to a total of 33,139 since the beginning of the epidemic. Now, for the past week that ended last Saturday, August 22nd, by the date at which the test was run, we averaged 98 cases per day. That's the lowest weekly average we've had yet, and the first time we've been below 100. Now, that number is likely to rise a little bit because some laboratories are late in reporting their data to us. That is still very good news. Also, last week, we averaged 3.4% of people who were testing positive. That also is the lowest number we've had yet. The week before that, it was 4.1% positive. So I really like that trend in the downward direction. Since yesterday, we've identified no additional deaths from the infection, a total of 1,736 since the beginning of the epidemic. Our data on deaths comes in batches, but we're averaging about 1 to 2 deaths per day. Now, an update on testing. Last week, we tested 2,860 people per day on average. And we expect that number to rise a little bit with late reports. We are seeing some improvement in the delays in getting test results information back to people. Across all the sites in the city right now, people are getting the results back in 1.3 days on average. There is still one laboratory, the one called Quest, that is slow and is reporting their results in 4.2 days. Most people are getting the results back pretty quickly. We have updated the map on our website about where you can get tested with a lot of additional information, including where children can be tested. And that website is www.phila.gov/testing. Now, we've also been tracking data on mask use. We were observing masks in people exiting retail stores and in people in indoor SEPTA stations. And we had that data on a graph that we posted on our website, and we combined the data from retail stores and SEPTA stations in that graph. The percent people wearing masks was increasing in both settings, and that was good. But in the past few weeks, SEPTA has had some IT problems, which you may have heard of, And so in recent weeks, we've had no access to the SEPTA data. So we're now just going to be reporting data for people exiting retail stores. And for last week, the week that started on the 17th, 88% of people observed were wearing a mask. And that's an increase from 77% the week of July 27th. So clearly a trend in the right direction, not quite at 90%, but we want to be up at 90%. That's where we are in Philadelphia. Now in Pennsylvania as a whole, case counts are also falling. They've been falling about 4 weeks since late July. That's around the time that Governor Wolf signed his targeted mitigation order, which closed bars and limited indoor and outdoor gatherings. And I don't think those two are connected. Now in the US as a whole, case counts are still high, but they're also falling. They're falling for about 5 weeks now. And I believe that's the result of mask requirements in other parts of the country and other safety requirements, including closure of bars in many areas. But I do want to point out that this improvement in the epidemic isn't inevitable. In fact, in Europe right now, case rates are rising. And surprisingly, Philadelphia now has lower rates of this infection than Spain or France. The lesson is that we still need to follow the safety guidelines, especially masks. If we don't follow the safety guidelines, this virus could clearly come back. So that's where we are in Philadelphia. Our plans for the future are for reopening on September 8th, and we're still on track for that. So as of September 8th, the day after Labor Day, we will allow indoor dining with restrictions, and we will allow theaters to open up likewise with restrictions. There are continuing restrictions in other areas, so we will not be allowing the opening of nightclubs or conferences and conventions or senior centers. Indoor gatherings are still capped at 25 persons, and outdoor gatherings are capped at 50 persons. Also, I want to just remind people of what we're learning from our case interviews when we do our contact tracing about where this virus is most likely to be spread. It's mainly spread right now in Philadelphia among household members, among relatives, including relatives from other households, and among social gatherings with friends, including very small gatherings of just a few people, and with travel, and a group of people getting together and getting in a car together where there's people in close proximity and they can spread it in the car. So the lesson is that the people you trust the most are the ones that you're most likely to catch the infection from. Those are the ones that you're around, those are the ones you get close to, and those are the ones that typically people don't wear masks with. So you should trust those people, your relatives and your close friends in general, but not with COVID. So you should wear a mask when you're near your relatives and your friends. You should wear one at home when others are in the same room, and wear one when you visit others in their homes. This is especially important for people who are medically vulnerable, people over the age of 65 or people with chronic medical condition. Really, if you're in those situations, you should avoid contact with even relatives and caregivers that are out and about unless they're wearing a mask and you are also wearing a mask. For more information on where we're at with COVID, just go to our website, www.phila.gov/COVID. Thanks.
Thank you, Dr. Farley. We are going to turn it over now to Armando, who will deliver the Spanish language translation of both the mayor and Dr. Farley's remarks.
Palabras del alcalde Jim Kenney para el martes 25 de agosto del 2020. Como anunciamos la semana pasada, la ciudad y nuestros aliados comunitarios creamos el programa de acceso para apoyar a los niños más vulnerables de Filadelfia durante la etapa de aprendizaje digital. Quiero recordarles a las familias que es necesario registrarse. Las familias pueden hacerlo completando nuestro formulario en línea en phila.gov/accesscenters. Debo enfatizar que los centros de acceso no son guarderías, tampoco son un reemplazo para las escuelas. Por favor, tengan en cuenta también que estamos dándoles prioridad a los estudiantes cuyos padres o representantes deben trabajar fuera del hogar y que no pueden pagar o acceder a otra solución de cuidado infantil. Una vez que haya completado el formulario, un miembro de nuestro equipo lo llamará o le enviará un correo electrónico con los próximos pasos. Completar este formulario no garantiza un cupo para su hijo o hija. Es solo el primer paso para registrarse. Puede encontrar más información sobre los centros de acceso, incluidas las respuestas a las preguntas frecuentes que pueda tener, en phila.gov/accesscenters. Cintia Figueroa, vicealcaldesa de la Oficina para Niños y Familias de Filadelfia, está con nosotros el día de hoy para responder cualquier pregunta que pueda tener sobre la inscripción al centro de acceso. Bienvenida, Cintia. Si necesita acceso a Internet para el aprendizaje digital, PHL Connected puede ayudarle a conseguir acceso a Internet desde su hogar. El número al cual debe llamar para registrarse en PHL Connected es 211. Esta línea directa está abierta a las 24 horas del día, los 7 días de la semana y está disponible en más de 150 idiomas. Las familias con niños desde el kindergarten hasta el 12º grado de Filadelfia que no tengan acceso a Internet en el hogar o que tengan acceso a Internet solo a través de teléfonos móviles deben marcar el 211 y presionar la opción 1 para hablar con un navegador de recursos, que es la persona que les brindará asistencia durante el proceso de registro. Cuando las familias llamen a la línea directa, recibirán información general sobre PHL Connected, entre ellas los requisitos de elegibilidad para el programa y de cómo los hogares elegibles pueden conectarse. Hoy también están con nosotros Mark Wheeler, el director de información, y Otis Hackney, el director de educación, quienes puedan responder a sus preguntas sobre PHL Connected. Y esta es la actualización en materia de salud para el día martes 25 de agosto del 2020. Comenzamos el día de hoy con buenas noticias. Ha habido una disminución en el número de casos y en el porcentaje de casos positivos. El día de hoy reportamos 85 nuevos casos con un total de 33.139 casos reportados en total. Es el número más bajo que hemos reportado en semanas, menor a los 100 casos diarios. Este reporte toma en cuenta los resultados retrasados de los laboratorios, lo que implica que realmente son buenas noticias. La semana pasada se reportó un promedio de 3,4% de casos positivos. Es la cifra más baja reportada hasta el momento. La semana anterior reportamos 4,1% de casos positivos y el día de hoy no reportamos muertes por el COVID-19. En total, 1.736 personas han fallecido en Filadelfia a consecuencia de este virus. Respecto a las pruebas, promediamos 2.860 pruebas diarias durante la semana pasada. Esperamos que este número aumente para esta semana, ya que vamos a incluir los reportes retrasados de los laboratorios. Hemos visto también una mejora en el reporte de los resultados por parte de los laboratorios. En promedio, los laboratorios están reportando sus casos en 1,3 días, menos Quest, que representa un retraso aproximado de 4,2 días en sus reportes. El mapa de nuestro sitio web ha sido actualizado, incluyendo información sobre dónde los padres y representantes pueden llevar a sus niños a hacer la prueba, y es www.phila.gov/testing. En Pensilvania, los casos vienen disminuyendo desde julio, cuando el gobernador Wolf anunció la orden de mitigación, anunciando el cierre de los bares y limitando el número de personas en reuniones de cualquier tipo. Acerca de los Estados Unidos en su conjunto, los recuentos de casos siguen siendo altos, pero también es importante reconocer que los casos han estado disminuyendo durante las últimas 5 semanas. Esto ha sido el resultado del uso obligatorio de las máscaras y otros requisitos de seguridad, incluyendo la implementación de las barreras de plexiglas en ciertas áreas. Hay que ver la disminución de casos con mucho cuidado, sin embargo, porque los casos están aumentando en Europa en este momento. Pese a ello, Filadelfia tiene tasas de contagio más bajas que España o Francia. Los planes de reapertura están en camino. Muchas actividades se reanudarán el día martes 8 de septiembre, un día después del Día del Trabajo. Se reanudará el servicio en el interior de los restaurantes con restricciones, así como también se abrirán los teatros. Habrá, sin embargo, restricciones continuas. No se abrirán los clubes nocturnos ni se permitirá conferencias o convenciones, y los centros para personas mayores seguirán cerrados. Las reuniones en interiores aún quedan limitadas a 25 personas y cuando son al aire libre a 50 personas. Recuerde lo que hemos aprendido durante las entrevistas de los rastreadores de contagio respecto a la propagación de este virus. La forma principal de contagio es a través de los miembros de la familia, sus parientes, las reuniones sociales, incluyendo las de viajes cortos por la interacción que se tiene con otras personas que no llevan puesta una máscara. La lección que nos deja esta pandemia. Las personas en las que usted más confía son aquellas que es más probable que le contraigan la infección. Usted debe confiar en términos generales en su familia, pero no en los momentos del COVID-19. Así que, por favor, use una máscara cuando esté cerca de familiares y amigos. Use una en casa cuando esté con otras personas en la misma habitación. Y use su máscara cuando visite a otras personas. Esto es importante, especialmente para las poblaciones médicamente vulnerables. Si usted es mayor de 65 años o presenta condiciones médicas crónicas, usted está en riesgo. Por favor, evite el contacto con familiares o cuidadores que estén fuera de casa. Cuando estén cerca, tanto usted como ellos deben usar la mascarilla. Juntos podemos ganarle al COVID-19, así que por favor, use su máscara. Gracias.
Thank you, Armando. We will now move to our Q&A portion for members of the media. Today, the mayor and Dr. Farley are joined by Managing Director Brian Abernathy, Mark Wheeler, Chief Information Officer, Otis Hackney, Chief Education Officer, Cynthia Figueroa, Deputy Mayor with the Office of Children and Families, and Eva Gladstein, Deputy Managing Director of Health and Human Services. As usual, we will start with questions on topics related to the COVID-19 pandemic. So if your hand is raised now for another topic, please lower it and we will get to that later. We do have limited time during these briefings, so only one representative from each media outlet is permitted to ask questions. Reporters are asked to limit their questions to 3 or fewer, and we will do a second round of questions if time permits on other topics outside of COVID-19. For those logged in today, please use the raise your hand feature. It can be found under the participants list. We also ask that you use video to ask your question if you are able for broadcasting purposes. We will now unmute reporters one by one to ask questions, starting with Rosemary Connors of NBC 10.
Hi, I'm not sure who can answer this, but it's related to the access centers. So my first question is, do you know how many children you'll be able to accommodate around the city? Are you expecting that there may be an influx of families who want to take advantage of this service?
Rosemary, thank you for the question. This is Cynthia. I can answer that for you. So we are anticipating when we are at full capacity, and that's based on what we've identified now, is about the ability to serve 2,500 students. We saw that in the first few days of enrollment, we've had about just roughly 100 families that identify as eligible. As referenced in the earlier information, we're trying to make sure that if it's a internet access issue only, that we connect them to the other resources through PHL Connected, and that if it's a childcare issue, that we're supporting enrollment and focusing on the most vulnerable.
How many people, so 100 families that you've identified so far as eligible, how many people have applied thus far?
Just under 200 of the center. So the first phase includes 32. And in the second phase, we're excited that we'll be adding just over 40. So right now we've identified at least 3 phases. So we're tracking the demand to determine how much we need to expand in each one of those phases.
Okay. If I can get one last quick thing in. Are you concerned about being able to social distance and wear masks while serving the children and monitoring the children in these access centers?
So that's another great question. And we've had great guidance from the health department. And we're really taking from the experience we had in our summer camps. So both our summer camp and our out of school time providers who ran camps did remarkably well. So we did not have any major incidents in regards to contraction, both at a staff level or youth level. So we're using that opportunity to maintain the social distance practices that we've been given. And part of that is being really diligent, both in all the health and safety guidance that's been given to us by the health department.
Thank you, Deputy Mayor.
Thank you.
Thank you, Rosemary. We're going to go now to Manny Smith with CBS 3.
Hey, everybody. Just 3 questions from our team today. Number one, for Dr. Farley, asking about the college reopenings. I know that we covered Temple University reopening yesterday. Just wondering if there's any general concern about, that number of students all, getting together and around COVID concerns. We've seen other college campuses around the nation have to close after upticks.
Certainly, we're concerned about any of the colleges where they're bringing a bunch of students at one time. We work with the colleges around their safety plans starting back in July. They have, I think, strong safety plans for the things that they can clearly control. What happens in the classroom and things that happen on campus. It's far more difficult for them to address safety in areas they don't control, or if students are having a party off campus and a bunch get together. We asked them to do what they could on that and to message the right things. And we're going to be in close communication with them. And if we see a real problem with that, we'll see if we have to act. So far, so good. But we are, absolutely are concerned.
All right, thank you. Second question is for Mayor Kenney. The governor, Governor Wolf, just finished up the press conference rolling out some of his COVID initiatives, our COVID relief initiatives that he'd like to see rolled out in the state. He wants to pay for them partly by legalizing medical marijuana and reducing the alcohol tax. Was the mayor briefed on those? Any reaction?
I think it was recreational, wasn't it?
Recreational marijuana, yes. I'm sorry.
Yeah, we've been saying that for years, ever since we decriminalized the possession of small amounts of recreational marijuana, and the medical marijuana industry has been expanding in Philadelphia and elsewhere. There's no reason why that particular substance should be on a class 1 drug list. There's no reason why people should be arrested for it. And if alcohol is being sold and sponsored by the state as it is, there's no reason why recreational marijuana should not be in the same category as vodka and gin and whiskey.
All right. My last question is the homeless encampment and the COVID concerns around that. I know you guys are waiting for a ruling later today, but any updates on that, on getting people moved or housed, or any thoughts on that?
We have not received the final order the opinion from the judge at this point. We're waiting for that apparently around 3:00. We're still negotiating. We're still trying to make this come out the right way for everyone. We've placed about 100 people in shelter and in various areas of treatment. We've placed people in our COVID hotels. We're talking to them every day. And as I've said before, I'm not interested in confrontation. I'm interested in this amicably resolved, but they can't stay on public property forever. It's just not tenable. And hopefully the judge will agree with us and give us another reason why it should be moved.
Thank you very much.
Thanks, Manny. We're going to go to Michaela Winberg of Billy Penn.
Hey, good afternoon, everyone. I have a couple questions for Dr. Farley on testing. So some private testing sites in Philly have been announcing that they're rolling out the 15-minute antigen tests, the rapid tests. I know you previously said you were worried about false negatives from that kind of test. I'm wondering if your opinion on that has changed at all, or whether you think it might help mitigate testing delays in the city.
I'm still worried about false negatives. There may be a role for this. I'm not saying that they shouldn't do that, but I think they need to be very careful. For somebody who has symptoms or has a high likelihood of being positive, if they get a negative result, they need to have a regular test done to be sure that they're in fact negative. So it needs to be done very carefully.
What would you say to people who are maybe going to get the test now that it's more widely available? How would you advise regular Philadelphians?
I would advise them to just that if you have some reason to think that you are moderately high risk and you have a negative result, you better make sure you get a regular test, a PCR test, to be sure that you're in fact negative, because you don't want to assume that you're negative and be positive and then pass the infection on to other people as a result of that.
Right. Okay, just one more question. I read that the city plans to implement, Billy Penn reported that we planned to implement rapid testing at some city health centers in May. I'm wondering what ever happened with that.
There was the Abbott ID Now machine that came out that did, we evaluated how effective it was. It did give rapid results. It also gave a lot of false negative results. And so it got to the point where we didn't feel it was worth it. We essentially would have to repeat the test for almost everybody. And so I'm not sure if there's any of them that are still offering that test now, but it's not something that we're enthusiastic about because of the poor accuracy.
Got it. Okay. So no plans for rapid testing at any of the city sites anytime soon?
Not now. We're still awaiting a rapid test that has a high degree of accuracy, in which case then we would be very enthusiastic about rolling it out. But right now we haven't seen one.
Got it. Thank you so much.
Great. Thanks, Michaela. We're going to go now to Jack Tomsick with Metro.
Hello. This is for Dr. Farley. So are you saying that people should wear masks even when they're at home with family members who they live with?
If they're at home with family members they live with and they're not medically vulnerable, they don't need to wear a mask. However, if they're medically vulnerable, over the age of 65, or have a chronic medical condition, and their household members are out and about, and so that the household members may be exposed, then there's a risk that they may be exposed from those household members. In that case, they should. And I know that may feel like a lot to do, but for people who are medically vulnerable, this can be quite a serious infection. We are recommending that people who are visiting relatives who may live in a different house or close friends, that they wear a mask.
Okay, thank you. And then for Deputy Mayor Figueroa, is there an income requirement for the access centers?
We haven't set a floor ceiling, but we definitely are asking an income question in terms of determining the greatest need and based on the amount of applicants that we get. So we are monitoring salary, but we haven't set a hard guideline.
Right. Thank you. Those are my questions.
Sure.
Thanks, Jack. We're going to go to Martin Pratt of Philly YBN.
Hi, thank you. Quick question for Dr. Farley. Dr. Farley, have you been tracking what's been going on with nitric oxide gas in treatment of COVID?
I have not heard about that.
Okay. The second question is, can you explain what the president was able to do to get approved when it comes to blood plasma and the treatment of COVID?
Yeah, so people who have had COVID infection have antibodies after they recover. And so people have used that, the serum, the fraction of the blood that has those antibodies, and have administered that to people who have a new infection in the hopes that the antibodies in that blood might be able to reduce the severity of the infection in the people who are newly infected. That has been available through a study protocol that was coordinated by the Mayo Clinic for some number of months now. What happened yesterday or the day before, I forget, was that the FDA announced with the president there that they would have emergency use authorization, which makes it easier for physicians who want to use that treatment to use that for their patients. They need to get approval from the FDA, but it's a fairly streamlined approval process. It doesn't say that that treatment is proven to work. It does say it's an emergency, and if you have a patient that's in dire straits and you feel as a physician that the patient should get that treatment, that there's a mechanism for you to get that.
Thank you.
Thanks, Martin. We're going to move now to Iris Delgado with Telemundo.
Hello, this message or the question is for Cynthia Figueroa. Cynthia, I know you speak Spanish, so I'm going to go ahead and ask it in Spanish, just so that the public can hear directly from you. ¿Cómo lucirían estos centros de acceso para que las familias hispanohablantes tengan una mejor idea visualmente? ¿Cómo lucirían? Otra pregunta, ¿qué tipo de pruebas deben presentar los padres para poder calificar o cualificar? ¿Y cómo luciría un día típico una vez el hijo vaya al centro desde el comienzo, a qué hora exactamente, hasta el final del día, etcétera?
Pues hay muchas preguntas ahí, so voy a empezar al final, que es cómo es el día. Vamos a entrar a las 8 de la mañana, los programas van a empezar el septiembre 8 y vamos a tener el programa lunes hasta el viernes y queremos familias que pueden participar cada día de la semana porque queremos las familias que en necesidad necesitan cuidar de niños. A entrar van a firmar o entrar en el programa de la escuela. Como decimos antes, que estos no son programas no son escuelas, solamente están ahí para ayudar a los estudiantes a entrar en este programa. Vamos a dar comida durante el día, vamos a tener algunas actividades, ayudar que no están todo el día enfrente de la computadora. Y también vamos a tener... Cuando tenemos servicios afuera con otros programas de tener actividades afuera para tener un poquito de deportes. Y recuerda las otras preguntas que empezaste.
Claro, ¿qué tipo de prueba comprobante deberán someter los padres para poder cualificar?
Para cualificar estamos... queremos familias que no tienen internet en la casa, que no están conectados, pero también no tienen cuidado de niños y no tienen la manera para pagar para el cuidado de niños en la casa. So, si alguien en la casa que cuida a los niños tiene que trabajar afuera de la casa, ellos son que nos queremos que están en el centro.
Y esto es de kinder hasta 12, ¿no?
So, sí, hasta 12 años, pero el grado cuarto.
Right. Última pregunta rapidito. ¿Cuáles son algunos de los lugares más reconocidos comúnmente por la comunidad, tal vez en el norte de Filadelfia, en el sur de Filadelfia, que se van a prestar como este tipo de acceso? Por ejemplo, Congreso, Esperanza, entidades así que...
Sí, en el fase 2 vamos a tener un sitio en Congreso de Latinos, van a tener uno en Pan American Academy Charter School. También North Square también va a tener un centro que va a ser un poquito más grande. Y también Aspira en la escuela también va a tener un sitio. Y también el phila.gov /accesscenters que van a tener una mapa que puede ver los sitios también que están en la ciudad.
Y esta solicitud se somete por internet.
Pues tenemos internet, pero si alguien no tiene internet, tenemos un número a donde pueden llamar para también hablar sobre los sitios, y eso es 215-709-5366.
Gracias.
Gracias a ti, Iris.
Okay, thank you. We're going to go now. Go ahead.
Oh, I just didn't know if Armando, or if you want.
We're just going to move on now and not even say what you said?
It was a lot to unpack, so I'm asking for Armando's help in this. It was repeating a lot that has been said in terms of what are the requirements. She asked early on, what's a typical day at a center? I spoke about the enrollment and the qualifications necessary. She also asked about sites that are in well-known areas that serve the community. And so we talked about Congreso, North Square, and Aspira. And I did offer that there's a phone number that can be used in the event that you cannot access by the internet. Did I get everything, Armando?
You have also the requirement that there's no need for proof of income, but the fact that they don't have to have internet, those that don't have internet at home, no childcare or way to pay for it. And if they're working outside of the home, that it's basically K to 12 years of age or fourth grade. In addition to the places, there's a map of access, and the telephone number is 215-709-5366 for those seeking information on it. That there will be activities outdoors so that they're not spending all their day in front of the computer, and that there's going to be food served to them as well. And it's not a school, but it's only to help students access to education beginning at 8 a.m. on September the 8th, Monday through Friday, each day of the week.
Thank you.
Thank you.
Thank you both. We're going to move now to Laura McChrystal of the Inquirer.
Hi. First, I have a question for Dr. Farley. You mentioned that the weekly average of 98 cases for the week that ended Saturday was the lowest weekly average yet. I was just hoping to clarify, that is since when?
Yeah, I should to clarify that. That's really since the epidemic peaked back in April. And in the first week or two of March, when we first saw this, we would be lower than that. But it very rapidly got above 100 cases a day. And so it's since that time.
Okay, thanks. And another question, you mentioned that, the city is not yet able to allow nightclubs to reopen or conferences to resume. As far as activities, would you anticipate the city reaching a point where that could resume prior to us really having a vaccine or, all of this being over?
I'd say it's possible. I'm not going to put a timeline on it, number one. And number two, some of those restrictions are from the governor's order, and some of those are from the cities. And so the city cannot roll back any restrictions that the governor has. That would have to come from him.
Okay, thank you. And lastly, I have a question on trash pickup. I'm just wondering, if there is progress this week compared to last week. on the number of crews out there and any progress on hiring those temporary workers?
Yeah, I did not get the number of crews today. I didn't call the commissioner. We had about 339 people out in one form or another yesterday. I think we're 1 day behind on both trash and recycling. Again, we're out there every day working hard. I think we've hired, and the managing director can correct me if I'm wrong, I think we've hired 30 or so of the temporaries off the list. And there may be more that have reported today, but we're working as best we can. Hopefully the weather will begin to moderate a little bit, and we can get some more production.
Thanks.
Okay, thanks, Laura. We are going to move to Pat Loeb of KYW. Pat.
Thank you. This is for the mayor, or if Eva, if you have anything to add. The governor said that he doesn't think that he can extend the eviction moratorium beyond next week. Do you have concerns about what this will mean in Philadelphia? Is there any steps that you think you can take to protect people who are behind in their rent?
Eva?
Sure. Well, we're actively working on creating an eviction diversion program that we hope to have up and running at the very beginning of September, which would allow landlords and tenants together to go through a mediation or discussion process. So we're very hopeful that that will solve issues both for landlords and tenants, saving evictions, saving landlords costs, but also obviously avoiding evictions for tenants. The city, through the redevelopment authority, is actively trying to work with both tenants and landlords in terms of accessing the state rental assistance that is currently available. And one thing in the governor's announcement is he's also asked the legislature to make some modifications to that state rental assistance program, which would make it, we believe, better utilized than it is right now, because there are certain restrictions on it that make it difficult to access. So those are all pieces of work that we're doing. And of course, the last 3 years, we've had the Philadelphia Eviction Prevention Project, and are funding that again this year as well to provide assistance to tenants who have not accessed attorneys before an eviction hearing, and provide them with supports.
Thank you.
Thanks, Pat. We're going to go to Kennedy Rose of the Philadelphia Business Journal.
Hi, I have one quick question for Dr. Farley. I know you said last week that it was still very unlikely to have fans in the stands for Eagles games. I was wondering if there was any update on that, or if there was any date that you could provide just to give a final answer.
We are coordinating that discussion with the governor's office. So I can't give you a specific date on that. I certainly think it'd be very unlikely that there would be fans in the stands at the opening.
Okay, thanks so much.
Thanks, Kennedy. We're going to move to our second round of questions now, and we're going to go back to Martin Pratt of Philly YBN.
The first question is for, I guess, Brian or the mayor. The mailboxes and the mail situation for ballots. Are we going to increase the mailbox drop-offs, or drop-off ballot boxes, or are we thinking about creating a map or something for citizens to be able to find them easily?
I don't know, but we'll have to go. We get back to you. If somebody online now knows, please feel free, but I am not aware of any additional boxes. There may be, but we'll get back.
Okay, thank you. And then for the access centers, are we suggesting that parents accompany children to the access centers?
Yes, it's our preference that parents bring kids to sign in because there isn't transportation, and we're trying to have them within the community base just for safety. We are working with the crossing guards, though, to be available at schools that will be operating and access centers that will be operating.
Thank you.
Yep.
Great. Thanks, Martin. We're going to go now to Mike D'Onofrio with the Tribune.
Hey, thanks. I'm looking to see from the mayor, can you just provide some more information about the ongoing negotiations with encampment protesters? Have you come to any new agreements? Just anything.
No new agreements were you on earlier or no?
Yes, I was. I did get that they're ongoing negotiations, but I was wondering if you could kind of flesh those out a little bit.
No, not this time. There's nothing more to report, and we're waiting for the judge primarily. But in the meantime, we're still trying to get people into shelter and into appropriate treatment spaces for them. We've been doing that since the beginning of this thing.
And do you, sure.
Eva might want to weigh in.
Yeah, this is Eva. I just wanted to add that we were pleased this week. Individuals in the encampment actually removed empty tents, so they shrunk the footprint of the encampment a little bit because we have housed over 100 people. And I also wanted to just express our appreciation to two council members, Brooks and Gautier, who've been involved in conversations.
And you were referring to the Parkway encampment, right? Removing
Yes.
tents? Okay. And does the administration plan on immediately removing the camps if the judge sides in with the city, or are you going to give them a reprieve, 24 hours, 30 days?
We're not going to release our whatever strategy until it happens, but we will continue to work with them to get more people out of the camp voluntarily and into shelter. What we've been doing from the very beginning.
And does the administration just finally have any plan in place if a new encampment forms?
We'll cross that bridge when we come to it.
All right. That's all I got. Thanks.
Thanks, Mike. Seeing no further hands are raised, that will conclude today's briefing, and we will see everyone back here at 1 p.m. on Thursday. Thank you.